The ATS will position the patient standing with the majority of the weight placed on their uninjured leg and the involved leg in an internally rotated position with slight knee flexion for hip adduction and the knee slightly flexed for hip flexion. Maintain this position during application. The ATS will then apply tape adherent to the skin and select the appropriate size ACE wrap for the area to be treated. For hip flexion, the ATS anchors the extended end of the wrap on the mid-medial thigh directly to the skin and proceeds in a lateral direction around the thigh to encircle the anchor. The ATS continues to apply the wrap with moderate roll tension in a medial to lateral circular pattern, overlapping the wrap by half of the width and applying in a distal to proximal direction. The ATS applies the wrap at the proximal thigh in a medial to lateral direction across the lateral hip with a moderate upward pull, continuing to encircle the waist with mild roll tension and return to the proximal thigh. The ATS applies one circular pattern around the mid to proximal thigh across the lateral hip with a moderate upward pull, encircling the waist and returning to the proximal thigh. They will repeat this pattern 1 to 2 times. For hip flexion, the ATS will use a 2 to 3 inch elastic tape to anchor for athletic or work activities, anchoring on the mid-medial thigh and applying 2 to 4 continuous medial to lateral circular patterns around the thigh with moderate roll tension. At the proximal thigh, they will continue to apply the elastic tape across the lateral hip with moderate upward pull, encircling the waist with mild roll tension and anchoring on the circular tape pattern on the mid-thigh. No additional anchors are required.